everyone, I'm Gaurav, and welcome to my channel. If you're new here, I'm super excited to have you. I create content to help make life easier for anyone moving to or living in Austria. In my last video, we talked about the Meldezettel, Austria's compulsory address registration. Today, we're going to dive into something equally important, how the Austrian healthcare system works. No one plans on getting sick when they move to a new country, but it can happen. So, let's talk about what you need to know if you get sick in Austria and how you can access healthcare. Austria is known for having a high-quality healthcare system with modern hospitals and easy access to doctors and specialists. In fact, Austria ranks in the top 10 countries in the world for healthcare, including being number 9 in the World Health Organization, WHO, ranking in number 4 in the World Health Index. The healthcare system here is mainly public, but there's also an option for private healthcare. If you're a legal resident and part of the social security system, you're eligible for healthcare, but just a heads up, your treatment or medicines might not be completely free. What if you're a tourist or just a temporary resident? You can still get healthcare, but if you don't have insurance, you'll usually need to pay the full price for treatment. Let's break down the healthcare system in Austria and what to do if you get sick. How does the healthcare system work? Healthcare in Austria is covered by Social Security and everyone must be enrolled. For most people, signing up happens automatically when you start working. Each month, a portion of your salary is taken out to pay for it. This means the cost is based on your income, not your healthcare needs. Self-employed people have their own social insurance system. You need to sign up when you become self-employed, and just like the regular system, the cost is based on your earnings. Social insurance also covers other people, like your spouse, children, or even those who can't work, such as students, pensioners, and people on unemployment benefits. But, there are some exceptions. If you're an international student who isn't co-insured or an EU citizen who is self-supporting, you might need to get private insurance to make sure you're covered in Austria. What to do if you get sick in Austria? If you're feeling unwell and need to see a doctor, the first thing you'll do is contact your general practitioner, GP, or family doctor, called a Hausarzt in German. You will need to make an appointment, and when you do, be ready to share your name, contact details, and a brief description of why you need to see the doctor. To help you find a doctor, you can use websites like praxisplan.at or docfinder.at. I've added the links in the description. These sites show you where doctors are located and which languages they speak, so you can find one that's a good fit for you. If you need advice but it's not an emergency, you can also call the healthcare helpline at 1450 for help. Now, if you need more specialized care, like seeing a chiropractor or dermatologist, your GP can refer you to a specialist. But in Austria, you don't always need a referral if you already know what type of specialist you need. You can often book directly with them. To make an appointment with a doctor, you'll generally need an e-card or your social insurance number. If you don't have one, you may be treated as a private patient, which means you might have to pay more. What is the e-card? The e-card is Austria's healthcare card, which everyone in the social insurance system gets. It's a small card with an electronic chip that stores your health, accident, pension, and unemployment insurance info. I'll make a separate video on the e-card soon, so stay tuned. The e-card helps doctors check if you're covered by insurance and lets them know which provider will pay for your treatment. Since 2020, the e-card even includes your photo. Also, if you need to take sick leave from work in Austria, you must visit a doctor, even for something like a cold or the flu. This is required to officially take time off. One good thing to note is that there are plenty of doctors in Austria. According to the WHO, there are 52 doctors for every 10,000 people in Austria, way more than the 26 doctors per 10,000 people in the US. Annual health checkups are common here, even if you're feeling fine. They're usually free, and if you're self-employed, you can even get a free checkup that might help lower your social insurance costs if you meet certain health goals, like keeping a healthy weight. Healthcare in an emergency. If you're in an emergency situation, don't worry. Everyone in Austria is entitled to emergency medical care, even if you're a tourist. Here are the numbers to call for emergencies. 144 for an ambulance. 141 for emergency medical services. 112 for the European emergency number. There are hospitals in every district in big cities like Vienna, Graz, Innsbruck, and Salzburg have specialized hospitals with high-quality facilities. In Austria, each local authority is responsible for providing health care, so services can vary slightly between different provinces. Just like when visiting a doctor, if you go to the hospital, you'll need to show your e-card or social insurance number. However, if it's an emergency, doctors will treat you first before worrying about paperwork. If you're an EU citizen, make sure to show your European health insurance card for coverage. For tourists, it's a good idea to have travel insurance to cover any hospital costs in case of an accident or medical emergency. The good news is that many hospital staff in Austria speak English, but keep in mind that paramedics usually work in German. Let's talk about weekend doctors. In Austria, most doctors only work from Monday to Friday. However, each district has an emergency weekend doctor service, Notdienst, for medical issues that can't wait until Monday. For example, in the Kitzbühel district of Tyrol, the weekend doctor service rotates between different practices. You can find more details on the Kitzbühel district website. I'll provide the link in the description. In Vienna, you can find the contact details for weekend medical services on the City of Vienna website, link in the description. To find out about weekend doctor services in your area, check the website of your local medical provider. Now let's talk about basic medicines. If you're coming from places like the UK, you might be surprised to find that basic medicines like paracetamol and ibuprofen aren't as easy to buy in Austria. In the UK, you can pick up painkillers, cough medicine, and allergy tablets at the supermarket with your weekly shopping. But in Austria, you'll need to go to a pharmacy to buy medicine. Painkillers for headaches or allergy meds for hay fever are also more expensive here. There's also a bigger focus on natural or alternative treatments for things like colds and flu. Prescriptions. If your doctor gives you a prescription for medicine, you can fill it at any pharmacy in Austria. Just keep in mind, there's usually a small fee of about €6. Pharmacy hours can vary, and some pharmacies close for a break during lunch. But don't worry. The Austrian Chamber of Pharmacists has an online tool to help you find a nearby pharmacy, so you'll always know where to go. That's everything you need to know about the health system. If you found this helpful, like, subscribe, and drop a comment if you have any questions. See you in the next video.